Hello and good morning, everyone. My name is Jessie. I am the founder and one of the Cool Sculpting providers here at Element Body Lab. I've got our other provider back here in the background. You can see her. That's Jen. And what we're doing is Jen's second round of Cool Sculpting to her upper arm. And so if you joined us, what was that? 8 weeks ago? November? We did Jen's first round of treatment where we did 2 cycles to the upper arm on either side. It has been plenty of time for us to be able to know that Jen has a phenomenal result from her first session. We're doing her second session today. We're going to talk about that, but we are just going to do this whole thing live. That way you can see what treatment looks like from start to finish. So we're going to go back over to this mirror and I'm actually going to put some markings on Jen. So I'm grabbing my handy dandy little templates. We already put together a little bit of a plan yesterday, so we knew kind of what we were doing here. And we're gonna be from back behind. I think that's a pretty good angle. Yeah, cool. So, all right, Jen, talk to us about original goal with why you wanted to do Cool Sculpting to the upper arm.
So since I was young, I've always been concerned with how wide my arms were, how the circumference of them. So since the last treatment, I've definitely noticed that my shirts fit better around the sleeves, which is huge for me. My shirts have always felt tight around the arms, no matter how they fit on the rest of my abdomen. So that was very exciting for me. So I'm really excited to see how much more they'll go down.
Awesome. So what I'm going to have you do is actually just face the mirror for us. That way you're kind of at a better angle. Extend your left arm out. Perfect. So then bring your elbow down ever so slightly. So the great thing about Cool Sculpting is we are able to target pinchable pockets of fat. So the FDA clearance actually talks about you want to be targeting these pinchable pockets of fat, and it is FDA cleared to be able to target the fat in the upper arm. So now sloppy ballerina for me. We can call this whatever we want, just broken arm, sloppy wrist. I call it a sloppy ballerina, but what we're really looking for is where does the fat pick up and where does the fat fall off? And this is where the real artistry of Cool Sculpting makes a difference. Because how and where we place these hand pieces is the difference between Jen seeing the result she's looking for and seeing no difference at all. So I'm gonna come to the other angle here just to make sure, no, you guys are. She's trying to help me because if you don't know, I'm 9 months pregnant. So really all that I'm doing is making sure that I am mapped out exactly where I want to be. All right, extend arm out, palm down. I'm just making sure that I like this marking. So Jen, being a provider herself, kind of knows what it is that I'm looking for. But for you, you can probably see, and even whenever I'm pinching this, you can kind of see where the fat falls off, right where my finger is. That's right where our treatment actually will end. All right, let's mark out the other arm, Jen. Fantastic. So, everyone has a little bit of a different look from side to side. So no two people carry the same amount of distribution, the same amount of fat from side to side. So that's always pretty interesting. Bend elbow up for me. Fantastic. And so we don't ever assume that we're going to use the exact same hand pieces from side to side. So last time we did Jen's treatment, we had to treat all the way to her elbow in order to get full coverage of the area that we wanted to target. And this time we only need one hand piece in order to be able to target the entire space of what it is that we're hoping to treat. How do you feel about that, Jen? Awesome. So we always check from a couple of different views, forward facing, backward facing, and you can see that's targeting basically all the way down to her elbow, which is fantastic. All right, so now we're gonna get Jen in the treatment bed. And I am going to be working over on this side, but I want to make sure that you can see Jen and see all of the things that we're doing. I will talk you through each step of this process so you kind of know what to expect on Cool Sculpting treatment day should you be targeting your own upper arms. Jen's so helpful. She's getting everything all ready. So, as you can see, Jen's in a cute little bandeau. highly recommend you bring a change of clothes or something that you don't mind you get gel on. We're going to talk a little bit about the supplies that get used. And what I'm going to do is just kind of tuck this in just to absorb some of the gel that we could possibly get on this bra, because we have like a solid hour until we start seeing patients here in office. And so we were like, oh, it's the perfect time. Let's hurry, get our treatment in. So the first step is always going to be to put markings on, just to make sure that we've got the plan mapped out. About 70% of your results are going to come from making sure that those markings are in the right place and that your provider follows the markings. So what sometimes people ask me is, all CoolSculpting the same? Jen, is all CoolSculpting the same?
No.
No. So first, technology has evolved a ton over time. So we have the most up-to-date technology available today, but on top of the technology itself evolving, so your provider does make such a big difference, and how and what it is that they're doing can really impact the results that you see. So right now what I am doing is I am cleansing and prepping the skin, getting ready for this treatment. So you saw I used Sharpie on Jen, and now I'm just wiping her skin. So this, what I'm using is a pre-treatment skin wipe. It is a specially formulated skin prep wipe that actually has an active ingredient called propylene glycol. Now, propylene glycol is a fancy chemical that actually removes any moisture buildup on the skin, cleanses and preps it, helps us prevent any issues of moisture buildup on the skin. So if you have an allergy or a sensitivity to propylene glycol, that would actually be a reason not to pursue CoolSculpting, because this is how we make sure that we don't get frostbite, we don't get freezer burn. So very, very important, but also that's also why I'm using Sharpie, because you can see how much more subtle my line is now. We use that for a solid minute. What's our next step, Jen?
Gel pad.
So this is why we tell people to bring a change of clothes, is this handy dandy gel pad. So this gel pad is nylon cloth soaked in sugar water, so in fructose. You can see it's really sticky. But this is what we're trying to prevent from getting all over your clothes. So whenever we say bring a separate set of clothes, this is why. Jen, what does this feel like?
It feels like glue. Liquid glue.
Like liquid glue, like sugar water, like honey all over
honey
your
for
arms.
sure.
And then all that I'm doing is just grabbing a couple of straps, just different sizes and shapes of straps that I might find useful for this treatment. I usually like the same size on both sides. So I'm just making sure that I've got straps here that I like. And then let's take a look at our hand pieces. So this is the hand piece that we're going to be using to draw the fat on Jen's arm into our CoolSculpting handpiece. This handpiece actually is a C shape. You can hear the vacuum suction in it. And really all it does is it draws the fat away from the body and gets it really, really cold inside of this cup. We'll talk about the technology a bit. And I'm just making sure that I've got enough space. I don't want the full weight of your arm, Jen. Great. I'm gonna let go here. And then I am gonna double check to make sure that I am perfectly placed. And so we talked about the importance of those markings. And now comes the importance of following the markings, because if your markings were in the perfect place but you don't follow them, then they don't matter. So I like to make sure I'm in the exact right spot, and then these straps just act as an additional support. We're going to rotate Jen's arm down and forward and relax. And then all that I'm doing is making sure that my hoses are nice and comfortable and out of the way, and that the handpiece is nice and supported. So I may just make minor adjustments here and there just to make sure that Jen is nice and comfortable and feels like that handpiece is not going to fall off. How do you feel? Secure. Nice and secure. Awesome. So we start the first side, and then I do the other side. And that's a wrap. So while Jen is starting on this side, I'm going to be prepping the opposite side. So we're starting with her left side. It's really just provider preference. So sometimes I start on the left, sometimes I start on the right. I like to start on the dominant hand, and Jen is left-handed, as am I. Fun fact for the day. So I like to start on your dominant hand. And so sometimes people feel like their fingers are falling asleep. One of the things that you can do if you feel like your fingers are falling asleep is make sure your hands are below your heart. That will be a huge help. All right, what does it feel like, Jen?
It's getting cold, so it feels like I put an ice pack on.
So ice pack on the skin kind of sensation. But does it really hurt?
No, it's not the most comfortable thing in the world. Like if you hold on to ice for a really long time, it's that kind of like slight burning sensation, but it's nothing crazy.
Right. So I always find that it like stings, tingles, burns just a little bit for those first 5 to 7 minutes. It's a 35-minute active treatment. So you can tell I'm standing over here prepping this other side. So I'm serving as a really good distraction. But once I get Jen all hooked up, usually what we would do is just leave the room and let you hang out and just chill. But for the sake of today's live, we're probably going to use our time together just to answer some FAQs that we get here a lot. But the purpose of this first 5 minutes, this cooling cycle, is it uses a heat extraction process. So it's slowly getting colder and colder and colder. And then cold acts like a natural anesthetic, so you do go numb, which is kind of a great thing. So I think that the cold goes away, but I never feel the pressure go away. I always feel that like sensation of suction. Just is what it is. Doesn't hurt, just I can always feel that. So we have put cleansing wipe on the arm. Now we're putting gel pad over on this right arm. Again, highly recommend bring a change of clothes or something that you don't mind getting dirty, because this gel, it gets everywhere. I heard this past week it's the glitter of CoolSculpting, and I thought that was really funny that it just gets everywhere just like glitter does. So all that I'm doing is making sure that I have enough space to reach around. So I moved my machine ever so slightly to give me just a little bit more space. So you can just see me tap. That's all that I'm doing there. Whoop, so sorry. Great. That there will give me enough room. And full weight of your arm. Sorry, I know I'm in right Neil's way, but it just is what it is for a second. So this is part of the process that you really care about as a provider. And so even though today's, like we're recording today's session on a live, I want to make sure that Jen gets the absolute best treatment possible. So sometimes you'll see me get really quiet. It's just because I want to make sure that I'm doing everything right. All right, how's that feel?
Yeah.
You feel like it's pulling towards you, or do I need to scoot the machine a little bit more?
That's better, yeah.
So we want to make sure that you're nice and comfortable, and we want to double check all of our placements. So one of the things that you'll see your provider do over and over here is just double check, just to make sure that everything's in the exact right place. That's a really great thing. It's attention to detail. I want to shift around just a little bit here. Just because those markings, they serve as our guide. They really are such an important part of the process. And I think so many providers, and you correct me if I'm wrong, Jen, you've been to many trainings, so many providers can be really reckless with this part. They just are in a huge hurry. They don't want to take the time to make sure they're in the exact right spot. I love that. I'm very happy with that. Okay, so then we start the other one. So now what you can see is Jen's got both arms hooked up. She has about 35 minutes on one arm and about 30 minutes left on the other. And then what we can do is just answer some questions over this time. Okay. Jen, you have a list of questions.
Yes. So, let's see.
Let's talk all about CoolSculpting.
Let's do this one first. How long does treatment take?
How long does treatment take?
So it just depends on the area and how many of these hand pieces that you put on. So for this one specifically, we can dual sculpt this area.
So what that means is 2 hand pieces going at once.
Yeah. So this is only going to take the 35 minutes for the treatment itself, but you'll be at the office for an hour.
Great. So every time we put a handpiece on, it ranges between 35 and 45 minutes. It really just depends upon the size of the handpiece as to how long those handpieces do need to be placed for an active treatment time. So active treatment time refers to how long that applicator has to stay put. Whenever you're sitting in the bed, once we get you hooked up, you can actually see the time count down. So you can see those handpieces running and you can see how long do you have left, which is a beautiful thing because then if you're like on a conference call, you can be like, oh, I've got 35 minutes or I've got 30 minutes before the next cycle or that cycle is over. So between 35 minutes and 45 minutes of active treatment per cycle. We can treat multiple places at once because we have the capability here too at Element Body Lab. But depending on how many cycles we're doing in a day will depend on how long the actual treatment is. So abdomens can range anywhere between 2 and 4 hours, arms 1 to 2 hours, thighs
2 hours,
2 to 4 hours, depending on if you're doing just the inner or the inner and the outer. But the best way to find out how long your treatment is to schedule a consult. So that's my advice there, because we get really detailed around what your treatment will look like. What other questions?
How many treatments do I need?
Whew, that's going to go along with time. It's a loaded question. Such a loaded question. So how many treatments you need? So people mean different things whenever they say treatments. So first I want to clarify some vocab terms. So what you're seeing on Jen right now is 2 cycles, 1 cycle to each arm. Some people call that a treatment. So if we're talking about cycle placement, how many cycles you need to get full coverage really depends upon your anatomy and your expectations, the part of the body that you're wanting to treat, so many different things. How many sessions you need, because sometimes people, whenever they say treatments, they mean how many treatment days. Like how many times am I going to need to come back into the office before I'm happy with my overall results. That one's easier to answer because it really depends upon how aggressive of a result you want. So what you should notice is about a 20 to 25% reduction with each round of treatment that you do. So Jen, do you feel like you saw about a 20% reduction in your arms after your first session?
Yeah, I'm a bit more of a slow responder. So it was, just about at that 20%.
Yeah. So 20% is the average. Some people respond a little more aggressive. Some people are a little less aggressive. But if you're wanting more than 20% of your fat gone, then you can expect multiple treatment days. Usually people do 2 to 3 sessions or treatment days in any one area before their goal is met. Personally, I did 3 rounds of treatment on one of my legs, 4 rounds of treatment on the other. I was really asymmetrical, but I spaced that over the course of years. And so it's not to say that you have to do all of that up front or immediately. You can certainly space it out, but you may want to prepare just in your own head that this is not kind of a one and done procedure. Chances are you're going to be at least spending a couple of treatment days with us before you're like doing cartwheels down the hall and feel like we've met the goal.
Okay. When will I see results?
When will you see results?
You'll see results full results is 3 months, but some people start seeing results like 6 to 8 weeks out.
Yes. So the fastest that you can absolutely notice any change is about a month. Most people start to notice those differences at about a month, and then full results is 3 to 4 months. If you are a slower responder, like Jen mentioned, she's a little bit slower of a responder. If you are a slower responder, results can take up to 6 months. So don't be disheartened, don't be frustrated if you don't notice any change at the 8-week mark. Like, you still have plenty of time. The things that kind of play into who responds really quickly and who responds a little slower, one of the big ones is your lymphatic system, and then the other one is your metabolism. So those two things kind of play hand in hand. So if you have a thyroid issue or an autoimmune disease, chances are you're going to be a slower responder. If you know you've got a slower metabolism, then you're probably going to be a slower responder. If you are like really heavy into cardio and you do cardio all the time, then you may notice your results a little bit quicker. Same thing goes if you do a lot of heavy weightlifting. You may notice your results a little bit faster. But that's not to say that you should expect to notice a difference at the 3-week mark. Expect to notice changes somewhere between 1 and 6 months. Usually it's about the 3 to 4 month mark for full result.
Yeah, I noticed when I really noticed the change was about 11 weeks.
11 weeks?
So almost at that 3 month mark.
Yeah.
That's when I like woke up one day and was like, whoa, something happened.
It kind of happens like that, where you just like wake up and you're like, oh, new body. Like, it just kind of like all happens at once. So you are officially 5 minutes in on both sides. So she's got 23 minutes left on one arm and 28 minutes left on the other. How are you feeling?
I'm feeling cold.
Yeah.
Oh, my arms.
Right.
Yeah, my legs are just fine.
Legs are just fine. But any pain?
No, it's just like, it's uncomfortable the first 5 minutes. I think for me, that's the most like intense part.
Mm-hmm.
The massage after isn't as crazy for me.
Funny.
But it's like, now I'm just like, it's there, I can tell it's there, but it's not distracting.
Yeah. Yeah, so it's one of those things, like you can see Jen's got her phone on her. She's just hanging out. Like, I mean, we don't want you moving around too much, but you can just sit, hang out. We've got comfy pillows back behind her back to like support her low back. And then you can see we've got like all of this delicious fuzzy blankets to keep her nice and cozy, nice and warm. So we even have like a little tray table that pulls across the bed to keep you comfortable. We usually set you up with some coffee, some tea, water, different snacks. That way you can just kind of sit back and hang out. But like I said, we're doing Q&A. What else we got?
Okay, let's see. What happens to the frozen fat cells?
Mm-hmm. You pee, poop, and sweat it out. So that's the non-sexy way to say this. But really what's happening inside of these hand pieces. So we talked about that suction. You can hear the suction in the room. It almost is like a vacuum hose at a car wash, draws your fat away from the body into those cooling cups. Then what happens inside of those cooling cups is it is controlled selective cooling that is changing the texture of those fat cells inside of that cooling cup alone. So you saw me being really meticulous with how and where I was placing those hand pieces. And it's because that selective cooling is targeting only what's in the hand piece. So I want to make sure that we are getting perfect placement and perfect contact, because that's how we get really great results. So then what happens is that cold changes the texture of the fat cells. So imagine putting a cup of warm butter in the refrigerator overnight. That change in texture then stimulates an inflammatory response where your white blood cells, which are called macrophages, come along and digest the treated fat. What your body can digest and process out in a natural programmed cell death is about 20 to 25%, which takes us back to that, like, what results should you expect? So then from there, your body then just excretes it through this natural process. It's the same way that you are excreting any dead tissue throughout the day, throughout life. So it's something that we're really used to doing. We kind of pass all of this dead tissue all the time and have this like natural cell turnover. So we're relying on that same process, and it is called an apoptotic response. That's the sexy scientific way to say it. We're triggering an apoptotic response and flushing the fat using your lymphatic system, but nobody knows what that means. So what that means is we're changing the texture of the fat by freezing it, and then you pee, poop, and sweat it out. So that's the real world application of that.
Okay, so next is, will my health insurance cover CoolSculpting?
This is one of my favorite questions, and man, I could write a paper over why your health insurance should, but no, they will not. I wish that they would. I wish that there was something I could tell you. I wish that there was something that we could do, because I definitely agree, fat is a problem, right? We all have this unwanted fat. It's a great procedure. It is a medical procedure. So you would think that if we're impacting quality of life, and like health and overall well-being, we can advocate for this. But the thing about CoolSculpting is that we're targeting the subcutaneous fat layer. So the fat layer that lies on top of the muscle wall, not below the muscle wall. So it's really an aesthetic procedure. This is a completely cosmetic procedure in nature, because we're not impacting the fat that your primary care doctor wants you to get rid of that lies below the muscle wall. They call that visceral fat. That's the type of fat that's really dangerous to your organs. And so since we're doing this for cosmetic reasons, even though that impacts the way you feel and mental health and overall well-being, unfortunately, insurance will not pay for it. You also cannot use your HSA or FSA. I've had some people use that, ask that in the past, and my big fear is they're gonna shoot you a big old nasty bill afterwards and you're gonna be mad at me. So no, you just have to use your cash, but you can't finance it. And so we do offer financing through Green Sky and through Care Credit. So Care Credit is 6 months deferred interest. Green Sky has longer repayment terms. So if you're looking for something longer than 6 months, my recommendation is Green Sky. There's pre-qualification processes on our pricing page. So elementbodylab.com, click the menu bar, click pricing. You'll see about halfway down. What else we got?
Can I gain weight after CoolSculpting?
You want to take this one?
Yes. So after the treated cells are gone, those cells are gone.
Mm-hmm.
You don't have those anymore.
Mm-hmm.
But the cells that are left behind are the ones that would cause that concern. So the short answer is yes, you can. The thing is that the cells that are left behind can grow and shrink with weight loss and weight gain. So the way that CoolSculpting works is it destroys the cells that it treats, 20 to 25% of those, but the cells that are left behind, you can still gain and lose weight.
Yes, so yes and no. You can gain and lose weight naturally. That's a beautiful thing. You want to be able to gain and lose weight naturally. But at the same time, you'll never have as many fat cells, which is what Jen's alluding to. With the fat cells, once they're gone, they're gone. They are actually destroyed, so they don't come back. But we are leaving fat cells behind, which means that you can gain and lose weight naturally, which is how we prevent. Sometimes people want to know, if I treat my arms and I get rid of the fat on my arms, and that's been the place that I've always carried, what's going to happen if I do put on 5 pounds? Am I going to gain it in my calves or in a weird place that I've never noticed it before? And the answer to that is no, because you have fat cells all over your body. You're going to gain weight, lose weight naturally, evenly distributed across the body, like those balloons that Jen was mentioning. So throughout the entire body, you'll gain and lose weight, but you'll never have as many fat cells in Jen's arms, for example, but whatever part of the body that you are interested in pursuing. And there's a little asterisk here. You do want to maintain your diet and exercise, and you want to maintain your weight within reason. Because if fat cells hit a critical cell size, which basically is just they can't get any bigger, they will duplicate. So that is why your doctor cares so much about obesity and wanting to make sure you stay below that obesity bracket. It's because the fat cells then can duplicate, and it makes it so much harder to gain and lose weight, or especially just to lose weight, because you have more fat cells throughout the body. So keep an eye on it. I mean, you're investing in your body if you invest in a CoolSculpting treatment. So invest in maintaining results with healthy diet and exercise.
Are there any side effects to treatment?
Always. There are risks and side effects of every decision you make. So a couple of really great tools that I want to point you to, because I think if you're considering CoolSculpting, the best thing that you can do is read the consent form. The second best thing you can do is read the manufacturer's patient safety data sheet, and I want to tell you how to get your hands on both. So if you go over to our website, elementbodylab.com, and you scroll all the way to the bottom of the page, you'll see in the footer, no matter what web page you're on, a link that says patient safety data. That links you directly to the CoolSculpting manufacturer's patient safety data sheet, which has all of the risks and side effects, all of the instance rates for those risks and side effects, and the studies that were done on said risks and side effects. All of that information is then translated into our consent form. So in our consent form, the way you get our actual consent form, you actually just attend a consultation. At the consultation, you're going to get a copy of the consent form, all of the risks and side effects. We're going to talk about your medical history, the clearance or the medical evaluation that we actually require prior to treatment. So Jen, before she did this, even though she's a certified CoolSculpting provider, had to go through the exact same process. So she had to meet with a medical professional and say, like, here's what's going on with my medical history, here's medications I'm taking, yada, yada, yada. Because there are reasons to not do CoolSculpting. There are four hard stops for CoolSculpting, at least here at Element Body Lab. 3 of them are contraindications no matter what facility you go to. So 3 are distinct allergies to colds. They are cryoglobulinemia, paroxysmal cold hemoglobinuria, and cold agglutinin disease. And if you just spaced out because you feel like I was speaking in another language, I feel you, I understand. But really what those are is distinct allergies to cold that if it gets below freezing, or if you have exposure to intense cold, you will actually end up either in a hospital or like passing blood through your urine. Like, you will know that you have these because whenever it gets below freezing outside, something happens for you. Those are usually secondary to other illnesses. And so that's why we want to talk about all of the different things that are going on in your medical history at that evaluation. So we'll give you instructions on how to do that and how to discuss that. That way you don't really waste any time. The 4th that I mentioned, I said that there were 4 reasons not to treat. The 4th one here is pregnancy. We do not treat pregnant or breastfeeding clients at Element Body Lab because it hasn't been studied. So I get all the time, like, patients want to know, like, why not while breastfeeding? Because, like, I get it. Like, I've got this little bundle of joy inside of me, and I can't wait for him to not be inside of me so I can do some CoolSculpting and get back to my life. But it's one of those things that we don't know how the fat would be excreted through the lymphatic system or pass through breast milk. And it hasn't been studied. And since it hasn't been studied, we don't know if it's safe. And so there are practices and providers who may say, absolutely, we're happy to treat you if you're breastfeeding. We are not of that camp. So we would say wait until you are finished breastfeeding, and also give it 6 months just to let your hormones all kind of settle. That's a conservative recommendation. You could probably do it sooner than that, but we're a little conservative in our approach to treatment. You got anything to add to that?
I think you have more on that than I do.
Yeah, that was me. All right, what else?
Okay, what parts of the body can I treat?
Head, shoulders, knees, and toes. All of the places. So there are 9 different FDA clearances for safe places to treat with CoolSculpting. They start kind of up at the chin and they work all the way down to the knee. So the chin, we call this the submandibular or submental treatment, just depending on if we're doing one kind of smack dab in the center or all the way along the jawline. We can treat bra fat, which is up in the back or up in the front. We can treat upper arms, which is what we're doing today on Jen. We can treat the abdomen, the love handles. The side of the body is anatomically called the flank. So you can treat both the high flank, like high in the waistline, and low through the hips, like the muffin top. The anatomical version of that is called a flank. We can also treat the inner thighs, the outer thighs, the place beneath the butt, which is called a banana roll. We can also treat the distal thigh, which is the spot above the knee. So the joke is, if it's squeezable, it's freezable, because that's really what we're looking for, is pinchable, pliable fat. Now, just because you can treat an area does not mean you should treat an area. So let me say that one more time. Just because you can treat an area doesn't mean you should treat an area. And we are all for making sure that the treatments that we give here are aligned with the client's goal. And so I know we've got consults. We've got one consult today where the gal, her real goal is to get rid of cellulite. And so whenever you're booking your consultation, you're going to talk about your goals and you're going to upload a photo of the area that you're going to treat. And so I know we have a consult today. I've seen her photo. We could definitely do a treatment on her, but it's not really what she's looking for. And so my guess is the conversation is going to go like, hey, if you're really looking at cellulite, here's our recommendation for different cellulite procedures, which we don't do here because all we do is CoolSculpting. And so you can count on the fact that if you do a consultation with us, if the goal doesn't perfectly align with what CoolSculpting can do or what the capabilities of the technology are, either myself or Jen, depending on who's doing the consultation, will tell you, hey, this may not be the best idea for you. Hey, this is a better recommendation, and here's somebody that we trust in the industry. So we'll point you in the right direction, even if it isn't a good fit. So that's the benefit of doing a consult. They are totally free. We're just here to help. What else?
I think that answered all the questions that are on this list.
What other questions do you feel like you get? Cost is the big one.
Cost is the biggest one.
Cost is the biggest one.
Yeah, and then like, does it hurt? It's not comfortable. It's not like the most comfortable thing in the world, but it's not
The worst.
Yeah, it's not the worst in comparison to, like, say, invasive procedures.
So I can tell you, I've had a contraction while we've been on this live, so it's nothing in comparison. I did a reel not that long ago where it was like, I had a consult who told me that sheared CoolSculpting feels like childbirth, and I was like, I don't know who told you that, but I will tell you, contractions are much harder. I definitely don't think it's the most comfortable treatment though, so I would not recommend that you try and do a conference call or a video call, much like this. Like, Jen's a real trooper.
Got a good poker face.
Yeah. It's not the best, but it's also not going to be something that completely knocks you off your feet. It's not something that it's so painful that you're like, it takes your breath away, or that you like feel like you need to cry.
If it was that, then we would have many patients who never came back, and we have patients come back all the time.
Yeah, about 90% of our patients come back for additional treatments, and so that really speaks to the fact that they want to do additional treatments because they love their results or they like the experience. Every once in a while, someone's like, that massage though, like that massage was just not for me.
But then they come back anyways.
I know, they always do. Okay, so what makes someone feel really well prepared? Like, did you need to do anything to prepare for this treatment? Besides run to the room and sign a consent form.
Go to the bathroom.
Yeah, that's always a really good piece of advice. So we usually tell people, like, run to the restroom before we get started because you're sitting still for an hour, or for 35 minutes, or for 45, just depending on the size of the handpiece. And so it's always a good idea, like, run to the restroom before you start. And also in between cycles, if we were doing multiples, I'd probably say get up, stretch your legs, run to the restroom, just so you're not like sitting super still. Yeah. But other than that, drink plenty of water. Everybody I know is dehydrated.
Maybe eat before you get here. Eat before your treatment for sure.
That's a good one. Yeah, it can make you feel a little dizzy, lightheaded, or nauseous if you don't have anything to eat. So eat something. Yeah. What did you eat before this? She hates breakfast. She's not a compliant patient.
I just hate breakfast in the morning, but I will drink a protein shake. So that's usually my breakfast. So
yeah, so if you're someone who usually eat breakfast. I would eat breakfast before this, but I was like, I know Jen. Jen probably did not eat any breakfast.
Like, I've got my lunch, but the protein shake's fine.
Yes. Yeah, so and then change of clothes. That's the other thing that I always tell people. Just like we talked about whenever I was prepping Jen's skin, we do our best to like protect the area that we're treating, put towels along everything. Just to kind of keep you as tidy as we can. That being said, like that gel, it gets everywhere. It's gonna get in your hair, it's gonna get on your clothes, like it's all over the place. And so even though we feel like we're being as like precise and concise as we can with that gel pad, I swear it ends up in weird places. So bring a change of clothes. That's good practice.
We also have disposable undergarments.
Mm-hmm.
They're not they're there. They're just basically paper. But so that's something that you would prefer to wear rather than your clothes, and we have them.
Yeah, so we usually take photos in those disposable undergarments because it creates a really, really consistent before and after photo. So a lot of times we will have you, almost all of the time, we're going to have you change into those disposable undergarments unless what you're wearing actually is a better choice. So usually you're going to get put in those disposable undergarments, and then we're going to give you the option to put back on clothes before we get started in the treatment, or you can just be treated in the disposables. Some people actually prefer just to be treated in the disposable undergarments because then they don't have to worry about anything getting on their clothes. It's totally up to you. So this room and this space is yours. We're just here to help and like facilitate and provide our expertise and administer a treatment. You wear what you want. We don't really care. And then kind of do what you want for the entirety of the treatment, which we're getting pretty close to being done with Jen's arm.
Pretty close.
We're getting pretty close to that massage, which I want to talk to you a little bit about post-treatment care, or what to do after a CoolSculpting treatment, which is really not a whole lot that you need to do. So whenever you go home from your CoolSculpting treatment, like Jen's not going to have any restrictions. Immediately after this, we actually have consults and appointments. And so Jen's just going to get back into her normal patient flow. She just lucked out that we had an hour to be able to get her treatment in. And I was like, sit down, hurry. There's no restrictions or downtime, nothing that you really cannot do. We usually recommend avoiding major, massive exfoliants, avoid a bunch of sun exposure. Try and just be mindful you did have a treatment done. So like, if the skin feels sensitive, you're also numb to touch. So from a perspective of normal side effects, things that she should expect, redness, swelling, bruising, and numbness are all very, very normal and should be expected. Redness, whenever we take that handpiece off, you're going to notice that the skin looks bright red. Numbness will last a couple of weeks. For Jen, we actually have in our highlight reel on our Instagram page a time lapse of her bruising, because she didn't bruise immediately, but she did develop some bruises after the treatment. So that's important to know, because sometimes people don't want anybody to know that they did a treatment. If you're keeping a secret from someone and you have big old bruises on the back of your arms, you're gonna have some explaining to do. So keep that in mind as you schedule your session. But outside of that, really there's not a whole lot that you really need to do. So sometimes people like to wear compression garments. That's a great thing to do if you want to, but it's not required. Drink plenty of water, because the fat's leaving the body through your lymphatic system. Maintain a healthy diet and exercise program, just maintaining your weight and overall wellness. And then we really recommend this product called Elastin. So Elastin Transform Body Treatment is a topical cream. You may have heard me talk about it either in office or in other videos. It is a topical cream, like I mentioned, that you will use twice a day after your CoolSculpting treatment. And it will help stimulate the macrophages, or the white blood cells, to come attack that frozen fat and get you your results faster, and also get you a little bit more of aggressive results, because it helps break down the treated fat. So there's some really interesting studies. I actually have a video on our Instagram page, on our website. I send it after a consultation that I actually break down the science behind that cream. It's totally optional, but if you're going to invest in CoolSculpting, might be worth investing in this cream that will help you get your results faster and more aggressively, because you may not have to be as aggressive with your treatment. Anything else?
Just highly recommend Elastin.
Yeah, we love it. Yeah, we love it. We like baited it for a while where we were like, do we really love it? And we were like, yeah, we really love it. I can tell you kind of firsthand my experience. I've been using it while I've been pregnant, and I am susceptible to stretch marks, and I have 0 stretch marks on my abdomen. My abdomen has better integrity to the skin than my face right now. So we really need to do something about that. But, you know, what are we going to do? All right, so we have a minute and a half left over on Jen's left arm, so I'm going to get all queued up over here. So Jen, what's the next step?
Gonna take the suction's gonna get turned off, cycle gets turned off, and then the massage.
The handy dandy massage.
The massage.
What does the massage do?
So it manually breaks apart the frozen fat cells. It has to be done within a certain time frame. So it breaks down the frozen fat cells manually, like you just break it up with your hands. And that helps to kind of like, gives you 68% better results with your CoolSculpting, and helps kind of kickstart and reperfuse that area with your blood.
So definitely necessary.
Yes.
So sometimes people are like, do you have to?
Yes.
Yes, I do. You're paying me. You paid me for this.
Yes. You won't leave without getting it done.
You paid me for this. So Jen's instinct is going to be to help me. I don't need your help.
Yeah. I'll just be like a fish.
I'll just be like a fish. So this is the part of the treatment that usually people think is the most uncomfortable. So whenever you talk about CoolSculpting being painful, the technology has come a long way. So I want to talk about that first, and then I want to talk about kind of what the sensation of the massage feels like as we're doing it. So back in the day, The CoolSculpting hand pieces, they actually were cooling panels. And so they were these intense cooling panels. I'm just lifting Jen's arm out of here. Hold your arm up for me. Perfect. Oh yeah, you can see that.
Yeah.
Beautiful.
Super red and lovely.
Red and lovely. And I got exactly where I want it to be. So Jen's gonna take a photo because we've got a really cool little gel trap imprint here. So back in the day, the CoolSculpting hand pieces, very satisfying. So the CoolSculpting hand pieces used cooling panels instead of cooling cups. I showed you the inside of the cup at the beginning of this video. I'll show it to you again. But that, well, help me keep time.
Yeah.
We do this massage for 2 minutes. I pushed the wrong button. So we actually, the cooling panels had to use significantly more suction than what it is that we can actually use now. So that significant more suction equated to significantly more pain. So whenever someone tells me they've been treated with CoolSculpting and it really, really hurts, my first question is when? My second question is, whenever you say it really hurt, was it the entire time or was it the massage? Was it short-lived? Like, talk to me about what that means. Because everybody means something a little bit different whenever they talk about that pain associated with treatment. If you have been treated recently, which I mean like 2022, because the CoolSculpting Elite technology launched in 2022, then it can just be uncomfortable. Like, this part of the treatment's just uncomfortable. We are butting frozen fat cells up against each other and causing a blood rush back to the arms or whatever part of the body we've treated, and we're killing your fat. Like, it's not meant to be a Swedish massage. It's meant to kind of suck. But, like, it's meant to work. And so I am halfway through this massage. So my first minute I spent more like kneading, you saw that. Now my second minute of this massage, I'm gonna be doing more just kind of like rubbing to make sure that we get really natural, beautiful feathering of the treatment. Now you can see Jen is not talking nearly as much.
It's honestly like this area isn't as bad as like maybe other areas might be for me. And I think it's like not the area that was inside the cup, it's kind of the surrounding area where I still have some feeling.
Yeah, I do think that it's always like the right around the outside, that's where it
Yeah.
hurts the worst, not like the center of the treatment itself. But I see all of the signs from a provider standpoint that I really want to see. So red skin, firm fat. I see a little gel trap imprint right where I want it. I am grabbing some of my elastin, like I mentioned, now that I've broken up some of that gel, because I like to get some of the gel off first before I really like rub this elastin in. Oh, you're good. You're 2 minutes in.
Yay.
Awesome.
Reset.
Reset. How am I doing on time?
2 minutes in this one.
2 minutes to go. So, in the meantime, I'm just going to kind of clean up. So, what's it feel like now, Jen?
It feels burning.
Burning how?
How would I describe it? Like I pulled a muscle. Kind of. Not quite like I pulled a muscle. Like a little bit. It's like, you know that feeling when you get Charlie horse in your leg right before it actually happens? You feel that kind of like strain, kind of. It's kind of like that. I feel like I need to stretch it a little bit.
Yeah. Some people like the feeling of like stretching. Some people like pressure.
Yeah, I like pressure.
Yeah, the pressure can really help. So if you're really uncomfortable and it's right after a CoolSculpting treatment for you, or if you're wondering if there's anything a provider can do to help give you comfort, I think pressure is one of the best things. Just that pressure can really, really take some of the relief off. The other thing you can do is you can push it actually into the bed. It doesn't work.
It's cold
as
on my
bad.
skin.
Yeah, it doesn't work as well.
It's cold on my skin, yep.
But then we're going to do the exact same thing on the other side. The good news is this side, you have a much better view. So you'll be able to see. Right. And so we talked about the normal stuff that Jen should expect after CoolSculpting. There are some more rare side effects that can happen. And so I pointed you to the patient safety data sheets. elementbodylab.com, scroll all the way to the bottom. There's a patient safety data sheet that talks about the risks and side effects there. But the stuff that's not as common but can happen. One of them is called late onset pain. We feel like about 15% of the patients within our facility notice this. The global incidence rate is much lower, but I think part of that's just because of like a reporting situation. So about 15% of our patients notice it. It feels almost like glass underneath the skin, or like zingers, like just these like almost little bee stings right in the area. So I am just peeling this applicator away, getting it out of my way, and you can see Jen's skin bright red, right where we want it to be. Yay. All right, and then I'm starting our massage. So that's the most common of our rare side effects, is late onset pain. Sometimes patients get other stuff like subcutaneous indurations, which are little hardened fat cells underneath the surface. That can happen. It resolves on its own. The scariest thing that can happen after a CoolSculpting treatment is called paradoxical adipose hyperplasia. It's a big fancy word that means the reverse of what you want to happen happening. So instead of depleting fat cells in the area, you duplicate them. The risk factor for that is 1 in 3,000 globally. So it's not very common, but it is a risk, and you'll want to know about it, be really well informed on it before you pursue a CoolSculpting treatment. There are some other things that can happen, like hyperpigmentation and frostbite. So do some research on that patient safety data sheet. You can always ask your provider about their experience, what happens if that does occur. If you're a client here, we'll talk to you about all of the ins and outs, just that way you know all of the information around all of the risks and side effects. So any different sensation on this side versus the other?
This one isn't as intense as the other. I'm left hand dominant, so that could be the reason why. Don't know. Like it's different for everybody. But yeah, this side's not as intense as the other side.
Yeah, I feel like the left side usually is more intense on almost everyone. I don't know why, but
yeah, strange.
If you know why, you can send me a message. Send me a DM. I would love to know. We've got about 20 seconds to go on this massage. And like we've already talked about, no restrictions, no downtime, nothing that Jen cannot do. When should you notice a difference, Jen?
About 6 to 8 weeks. For me, I give myself like that 3 months.
Mm-hmm.
Just because I'm a slow responder.
We are very, very conservative with arms and legs here at Element Body Lab. So we can be more aggressive in places like the abdomen and the love handles, the back line. But we will tell you one of the places that we are very conservative is the arms and legs. So we'll usually wait that full 3 months before we do multiple rounds of treatment there.
And now the kind of stinging feeling in my left arm's kind of gone away. Cool. So it was pretty temporary.
And so then all that I'm doing is I'm rubbing that elastin in just to help stimulate some of Jen's results. Great. That's a wrap. We're done with treatment. Welcome to your CoolSculpting upper arm live treatment, start to finish. Hope this was helpful. If you are ready to get started, or if you do have any questions for us, the easiest way to talk one-on-one and kind of get acclimated with your treatment, your goals, is just to schedule a virtual consultation. We would be honored to talk to you. You'd be chatting with one of us. So it's a video call just like this. We're going to answer your questions and guide you on how to take the next steps. Thank you for joining in, and we will see you soon. Bye for now.